Explain the process of scaling and polishing in veterinary dentistry and its importance in the prevention of periodontal disease. What complications could arise if this procedure is performed improperly? Answer. Scaling and polishing are critical components of veterinary dentistry aimed at preventing and managing periodontal disease. Scaling involves the removal of plaque and calculus tartar from the teeth using manual scalers or ultrasonic devices. The process should target both supragingival and subgingival areas since subgingival plaque is a major cause of periodontal disease. Polishing follows scaling and smoothens the enamel surface using a low-speed handpiece with a polishing paste. This step minimizes the adhesion of plaque to the tooth surface. Importance in preventing periodontal disease. Removes biofilm and tartar that harbor bacteria, reduces gingival inflammation and prevents progression to advanced periodontal disease. Potential complications. Excessive pressure. Using too much pressure during scaling can damage the enamel or soft tissues, leading to tooth sensitivity or gum injuries. Thermal damage. Ultrasonic scalers, if not used with adequate water irrigation, can cause heat-induced pulp damage. Incomplete cleaning. Leaving calculus under the gum line increases the risk of persistent or worsened periodontal disease. Understanding these principles ensures safe and effective treatment, emphasizing prevention as a cornerstone of veterinary dental care. Dr. Johnson is conducting an oral examination on a 5-year-old golden retriever named Bella. During the exam, he notices a pronounced malocclusion where Bella's lower jaw protrudes beyond her upper jaw under bite. Bella's owner reports difficulty in chewing and occasional oral bleeding. Based on the findings, what diagnostic and treatment steps should Dr. Johnson consider? Answer. The described condition is prognathism, a type of skeletal malocclusion commonly seen in brachycephalic breeds but less typical in golden retrievers. Dr. Johnson should take the following steps. 1. Diagnostic steps. Perform a full oral examination, including dental charting to document the malocclusion and its effects. Take intraoral radiographs to assess the alignment of teeth, jawbone structure, and presence of dental trauma or resorptive lesions. Evaluate for secondary complications such as gingival trauma, enamel wear, or periodontal disease. 2. Treatment options. Orthodontic adjustment. For severe cases causing pain or dysfunction, refer to a veterinary dentist for orthodontic correction such as crown reduction or appliance fitting. Selective extraction. If certain teeth cause trauma, extractions may be necessary to alleviate discomfort. Ongoing management. Implement regular dental cleaning and provide guidance on diet modifications to ease chewing. Why is identifying gastrointestinal parasites important in veterinary practice? Discuss the diagnostic tools used for internal parasite detection. Answer. Identifying gastrointestinal parasites is critical for animal health and zoonotic disease prevention. These parasites, such as roundworms, Toxocar spp, and hookworms, Ancylosur epp, can cause significant morbidity in animals and humans. Diagnostic tools. Fecal flotation detects eggs using solutions like zinc sulfate are best for nematodes and cestodes. Direct smear identifies motile protozoa such as Giardia. A ELISA tests confirms infections with parasites like Giardia or Cryptosporidium. PCR assays detect specific parasitic DNA, offering high sensitivity for infections like Trichomonas. Routine screening is advised, particularly in young animals and those with gastrointestinal symptoms. MS. Patel brings her outdoor cat Whiskers to the clinic due to severe itching and hair loss around the neck and tail base. Upon examination, you find evidence of flea dirt and redness along these areas. What steps should be taken for diagnosis, treatment, and prevention of ectoparasite infestation? Answer. Diagnosis. Flea comb test. Collect and examine flea dirt to confirm its presence by weighing it to observe reddish-brown streaks, digested blood. Skin scraping. Rule out secondary mite infestations. Treatment. Administer fast-acting adulticide, e.g. nitipiram. Start a long-acting flea prevention product such as fipronil or selamectin. Treat the environment with insect growth regulators, e.g. pyriproxyfen, to eliminate immature stages. Prevention. Regularly administer preventive treatments, especially for outdoor cats, and maintain environmental hygiene by vacuuming and washing bedding. Emphasizing integrated pest management minimizes the recurrence of infestations. Describe the process and significance of documenting dental findings using veterinary dental charts. Answer. Veterinary dental charts serve as a comprehensive record of a patient's oral health process. Record each tooth's condition using a standardized numbering system, e.g. Trident system. Document abnormalities such as fractures, gingival recession, or missing teeth. Include radiographic findings for subgingival issues. Significance. Facilitates communication between veterinary teams and with owners. tracks disease progression and treatment outcomes, legally protects against malpractice claims by providing detailed documentation. Compare and contrast manual and automated blood cell counting methods. What are the advantages and disadvantages of each in diagnosing anemia in a canine patient? Answer: manual counting. Advantages: allows visualization of cell morphology, identification of abnormalities such as Howell-Jolly bodies, Heinz bodies, or spherocytes, and detection of platelet clumps that might skew automated counts. Disadvantages: time-consuming, prone to human error, and requires expertise in morphology recognition. Automated counting. Advantages: provides rapid results, consistent counts, and multiple parameters like RPC distribution where OW mean corpuscular volume MCV. Disadvantages: limited by inability to identify morphological abnormalities and potential errors caused by clumped cells or artifacts. Automated counters are more efficient for routine diagnostics, while manual counts are critical when confirming or identifying specific morphological abnormalities that automated systems might miss. For diagnosing anemia, combining both methods is ideal to ensure accuracy and a comprehensive evaluation. Explain the pharmacokinetics of a drug administered via intravenous roman versus intramuscular injection. Which is preferable for rapid action and why? Answer: the pharmacokinetics of a drug varies based on the route of administration influencing its absorption, onset of action, and distribution. Intravenous Roman administration. Absorption. IV administration bypasses the absorption phase entirely, allowing the drug to enter systemic circulation immediately. This results in 100% bioavailability. Onset of action. The onset is rapid, with the drug reaching therapeutic levels in the bloodstream almost instantly. This is particularly beneficial in emergency situations. Distribution and elimination. IV drugs are distributed throughout the body quickly, and their elimination depends on the drug's metabolism and excretion rate. Intramuscular administration. Absorption. The drug is absorbed through muscle tissue into the bloodstream. The rate of absorption depends on blood flow to the site of injection, the solubility of the drug, and the volume injected. Onset of action. IM administration results in a slower onset of action compared to IV due to the absorption time. However, some IM injections may provide sustained release if the drug is formulated for depot release, distribution, and elimination. After absorption, the drug enters the systemic circulation, and its distribution and elimination follow the same principles as IV administration, though slower. Conclusion: IV administration is preferred for rapid action due to its immediate bioavailability and therapeutic effect, which is crucial in emergencies such as seizures, shock, or acute pain management. IM is more suitable for drugs requiring slower, sustained release or when IV access is difficult. Dr. Taylor receives a fine needle aspirate sample from a subcutaneous mass on a dog named Max. The cytological exam reveals a cluster of cells with a high nucleus to cytoplasm ratio, prominent nucleoli, and irregular mitotic figures. What should Dr. Taylor consider as a preliminary diagnosis, and what steps should follow? Answer: the cytological findings described suggest a neoplastic process likely malignant. The high nucleus to cytoplasm ratio, prominent nucleoli, and irregular mitotic figures are characteristic of tumor cells with high proliferative activity, possibly indicating a malignancy such as a soft tissue sarcoma, mast cell tumor, or malignant lymphoma. Preliminary diagnosis: the presence of abnormal cells with mitotic figures and an increased nucleus to cytoplasm ratio raises suspicion for a malignant tumor such as a soft tissue sarcoma. However, other types of malignancy, including mast cell tumors or histiocytic sarcoma, may also present with similar cytologic features. A definitive diagnosis will require further investigation. Next steps: histopathological biopsy. A tissue biopsy is essential to confirm the diagnosis. Fine needle aspirates can provide valuable information, but histopathology allows for more accurate classification of the tumor type. Staging: if malignancy is confirmed, staging should be performed to assess whether the tumor has spread. This may involve thoracic radiographs to check for lung metastasis, abdominal ultrasound for organ involvement, and possibly lymph node sampling. Treatment plan: surgical excision is often the first line of treatment for soft tissue sarcomas and other solid tumors. Marginal excision with wide margins is preferred to reduce the likelihood of recurrence. If the tumor is aggressive or has metastasized, adjuvant chemotherapy or radiation therapy may be indicated. Discuss the implications of performing a cystocentesis versus catheterization for urine collection in a feline patient suspected of bacterial cystitis. Answer: in feline patients with suspected bacterial cystitis, choosing the appropriate urine collection method is critical for obtaining a sterile sample and ensuring an accurate diagnosis. Cystocentesis: Advantages. Cystocentesis involves inserting a needle directly into the bladder to collect urine, minimizing contamination from the lower urinary tract. It is considered the gold standard for obtaining a sterile sample for culture and sensitivity testing. Disadvantages. Although generally safe, cystocentesis carries a slight risk of bladder perforation, especially in patients with small or distended bladders. It may be difficult to perform in stressed or uncooperative patients, requiring sedation or anesthesia. Catheterization. Advantages. Catheterization can be performed on conscious or sedated animals and it is less invasive than cystocentesis. Disadvantages. The major disadvantage is the higher risk of introducing contamination from the urethra or genital tract, which can lead to false positive bacterial cultures. It can also cause irritation or injury to the urethra, especially in male cats which have a narrow urethra. During a surgical procedure, the veterinary technician notes a significant drop in the patient's blood pressure. List the immediate steps to address hypotension under anesthesia. Answer. Hypotension during anesthesia is a serious concern as it can lead to inadequate perfusion of vital organs and affect anesthetic depth and recovery. Immediate action is required to stabilize the patient. Decrease anesthetic depth. The first step is to reduce the depth of anesthesia by decreasing the concentration of inhalant anesthetic agents, e.g. isoflurane or sevoflurane. This will help decrease vasodilation and lower the likelihood of hypotension due to anesthetic overdose. Administer intravenous fluids. Bolus IV fluids, e.g. crystalloids such as lactated Ringer's solution or saline, are administered to increase blood volume and improve perfusion. This is particularly effective if the hypotension is due to hypovolemia, e.g. from blood loss or dehydration, vasopressors and inotropes. If fluid therapy is insufficient, vasopressor drugs, e.g. dopamine, norepinephrine, or inotropes, e.g. dobutamine, should be administered to support cardiac output and increase systemic vascular resistance, which raises blood pressure. Evaluate for underlying causes. Assess the patient for other causes of hypotension such as blood loss, arrhythmias, or drug effects. Correct any underlying issues as appropriate. What are the key steps in identifying a bacterial pathogen from a canine ear infection using microbiological culture techniques? Answer. The identification of a bacterial pathogen from a canine ear infection involves several critical steps to ensure accurate results for effective treatment. Sample collection. Use a sterile swab to collect a sample from the ear canal, ensuring the swab does not contact any external surfaces to avoid contamination. The swab should be rotated in the ear canal to obtain a sufficient amount of discharge and cellular material for culture. Gram staining. Perform a gram stain to assess the bacterial morphology. This helps determine whether the bacteria are gram-positive, e.g. Staphylococcus or Streptococcus, or gram-negative, e.g. Pseudomonas or Escherichia coli, and provides insight into the appropriate culture media to use. Culture. Inoculate the sample onto appropriate culture media. Commonly used media include blood agar and McConkey agar for general bacterial growth. For ear infections, it is important to include media that supports both aerobic and anaerobic bacteria, as these can be present in the ear canal. Incubation. Incubate the cultures at 37 deg for 24 to 48 hours. Monitor for bacterial growth, noting colony morphology, size, and color. Isolate and subculture distinct colonies for further identification. Biochemical testing. Perform biochemical tests, e.g. catalase, coagulase, oxidase, to narrow down the bacterial species. These tests help identify the pathogen based on its metabolic properties. Antibiotic susceptibility testing. Once the pathogen is identified, perform antimicrobial susceptibility testing to determine the most effective antibiotics for treatment, helping to prevent resistance. Conclusion. Accurate identification of bacterial pathogens involves proper sample collection, initial gram staining, culture biochemical testing, and susceptibility testing. This ensures appropriate and effective antibiotic treatment for the canine ear infection. How should a veterinary technician assess and manage a feline patient that presents with dyspnea and cyanosis following a car accident? Answer. Dyspnea, difficulty breathing, and cyanosis, blue discoloration of mucous membranes due to hypoxia, are emergency signs in a feline patient, particularly following trauma. A thorough assessment and prompt intervention are essential. Initial assessment. Airway. Ensure the airway is patterned. Check for any obstructions such as trauma to the throat or foreign bodies. Administer oxygen if the patient is struggling to breathing. Assess the respiratory rate and effort. Look for signs of chest wall trauma such as rib fractures, flailed chest, or open chest wounds. Palpate the chest gently to detect crepitus, which suggests rib fractures or subcutaneous emphysema. Oxygen therapy. Provide supplemental oxygen via an oxygen mask or cage if cyanosis is present. The goal is to improve oxygenation and support respiratory function. Circulation. Check for signs of shock, e.g. tachycardia, weak pulses, low blood pressure. Administer IV fluids, e.g. lactated Ringer's solution, to stabilize the circulatory system and improve oxygen delivery. Chest radiograph. Perform thoracic radiographs to identify potential causes of dyspnea, such as pulmonary contusions, pneumothorax, or hemothorax, which are common in trauma cases. Management of pneumothorax or hemothorax. If pneumothorax or hemothorax is suspected, immediate interventions such as chest tube placement may be required to remove air or blood from the pleural cavity, allowing the lung to expand and improve breathing. How would you differentiate between diabetes mellitus and hyperadrenorcorticism in a canine patient based on clinical signs, lab results, and diagnostic tests? Answer: both diabetes mellitus and hyperadrenocorticism, Cushing's disease, can present with similar clinical signs in dogs, such as polyuria, polydipsia, and increased appetite. However, there are key differences in their pathophysiology, diagnostic findings, and management. Clinical signs. Diabetes mellitus, typically characterized by polyuria, polydipsia, weight loss despite normal or increased appetite, and lethargy. Dogs may also present with cataracts due to prolonged hypoglycemia. Hyperadrenocorticism. In addition to polyuria and polydipsia, affected dogs often have a pot-bellied appearance, hair thinning, hyperpigmentation, and pendulous abdomen. Muscle weakness and panting are also common. Laboratory findings. Diabetes mellitus. Laboratory findings include elevated blood glucose levels, glucosuria, and possibly ketonuria if the diabetes is poorly controlled. The dog may also have an elevated serum fructosamine, reflecting long-term hypoglycemia. Hyperadrenocorticism. Blood work often reveals elevated liver enzymes, ALT hypoglycemia due to cortisol-induced insulin resistance, and mild lymphopenia. Urine cortisol to creatinine ratio is often elevated, which is suggestive of Cushing's. Diagnostic tests. Diabetes mellitus. The definitive test is a persistent hypoglycemia with glucosuria. An insulin level test may be performed to assess the insulin response. Hyperadrenocorticism. Diagnostic testing includes the ACTH stimulation test or the low-dose dexamethasone suppression test. Both tests assess cortisol production, and abnormalities in these tests indicate Cushing's disease. Conclusion. Differentiating between diabetes mellitus and hyperadrenocorticism involves careful clinical evaluation, laboratory testing, and specific endocrine tests. The presence of high blood glucose and glucosuria points toward diabetes, while abnormal cortisol regulation suggests hyperadrenocorticism. How would a veterinary technician manage a suspected case of parvovirus in a young puppy? Answer: parvovirus is a highly contagious and potentially fatal disease affecting puppies, particularly those not fully vaccinated. Early intervention is key to managing parvovirus infections. Clinical assessment. Puppies with parvovirus often present with sudden onset vomiting, severe diarrhea, typically bloody, lethargy, and anorexia. Dehydration and shock were common due to fluid loss from vomiting and diarrhea. Diagnosis. A rapid enzyme immunoassay ELISA test can confirm parvovirus by detecting viral antigens in the feces. A positive test combined with clinical signs is diagnostic. If the test is negative but suspicion remains high, PCR testing can be performed for definitive diagnosis. Treatment. Fluid therapy. Parvovirus often leads to severe dehydration and electrolyte imbalances. IV fluids, e.g. crystalloids, are administered to restore hydration and maintain blood pressure. Antiemetics and antidiarrheals. Medications like meropitant, antiemetic, and metronidazole for diarrhea may be used to control symptoms, but they are supportive and not curative. Antibiotics. Due to the risk of secondary bacterial infections, broad-spectrum antibiotics like ampicillin or enrofloxacin are administered to prevent sepsis. Nutritional support. Once vomiting subsides, a bland diet or feeding tube may be necessary for nutritional support. Isolation and containment. Parvovirus is highly contagious, so infected puppies should be isolated in a hospital setting to prevent transmission to other animals. Cleaning and disinfecting with a parvovirus-specific disinfectant is essential to reduce the risk of environmental contamination. Conclusion. Management of parvovirus involves supportive care with fluids, antibiotics, antiemetics, and nutritional support. Early diagnosis and aggressive intervention increase survival rates. What are the steps to properly prepare and position a canine patient for a thoracic radiograph to assess for signs of heart failure? Answer: proper positioning and preparation are essential for obtaining diagnostic quality thoracic radiographs, particularly for evaluating conditions like heart failure. Preparation. Ensure the patient is calm and stable before the procedure. If the dog is stressed, sedation may be necessary to prevent movement during the radiograph and ensure accurate results. Have the appropriate size radiographic film or digital receptor and collimator ready. The room should be free of obstructions and the equipment should be calibrated. Positioning for lateral view. Position the dog in right lateral recumbency, lying on the right side, with the forelimbs pulled cranially and the hind limbs extended. Ensure the body is straight to prevent distortion of the thoracic structures. The radiograph beam should be centered on the mid-thorax to visualize the heart and lungs. The diaphragm should be included in the field of view to assess for signs of ascites or pleural effusion. Positioning for ventrodorsal view. Position the dog in ventrodorsal recumbency, lying on its back, with the forelimbs extended cranially and the hind limbs extended caudally. This view is useful for evaluating the cardiac silhouette and assessing for pleural effusion or other thoracic abnormalities. Ensure the thorax is symmetric and the radiograph beam is centered on the heart and lungs. Radiographic technique. Use appropriate exposure settings based on the patient's size and radiographic equipment. A high contrast setting will be needed to clearly differentiate the cardiac structures from surrounding tissues. Inspiration. Ensure the dog is in full inspiration for the best visualization of the lungs, heart, and diaphragm. Conclusion. Proper positioning of a canine patient for thoracic radiographs requires careful handling and correct patient alignment. These steps allow accurate assessment of heart size, shape, and lung fields, aiding in the diagnosis of heart failure. During a surgical procedure, a sterile surgical assistant accidentally brushes their gloved hand against a non-sterile surface. What actions should they take to maintain the sterile field, and why is this step critical? Answer. The sterile assistant must immediately inform the surgical team of the breach and replace the contaminated glove with a sterile one. If the contamination is more widespread or affects instruments within the sterile field, the instrument or any affected areas must be either replaced or re-sterilized. The surgical team must reassess the sterile field to ensure no further breaches. Maintaining sterility is crucial in preventing surgical site infections, SS, which can lead to severe complications, including delayed healing, prolonged hospitalization, or even sepsis. According to the Association of Perioperative Register Nurses, AORN, guidelines, any breach in the sterile field compromises the integrity of the environment and introduces the potential for pathogens to enter the surgical site. Surgical infections can lead to longer recovery times, the need for additional interventions, and increased healthcare costs. Immediate recognition and correction of breaches in sterility helps safeguard patient health by minimizing the risk of infection. Effective communication and quick responses are vital in maintaining sterile conditions throughout the surgery, ensuring that all team members are aware of potential risks and are prepared to address them swiftly. What are the main principles for achieving accurate lateral thoracic radiographs in a canine patient, and how do these principles affect diagnostic quality? Answer. The key principles for achieving an accurate lateral thoracic radiograph in a canine patient include positioning the patient laterally. The patient should be positioned so that the body is lying on its side, ensuring that the body is straight and the head and neck are aligned with the spine. This alignment allows for a true lateral view of the thoracic cavity. Extending the forelimbs and hind limbs. The forelimbs should be extended cranially forward, while the hind limbs should be extended caudally backward to prevent superimposition of the thorax and limbs. This positioning improves the clarity of the radiographic image. Collimating the X-ray beam. The radiographic beam should be collimated to the thoracic region to minimize scatter radiation and improve image quality. Proper positioning is essential because any misalignment can distort the image, leading to inaccurate results. For example, if the animal is not positioned correctly, critical anatomical structures such as the heart, lungs, or diaphragm may be obscured or misrepresented, affecting diagnostic accuracy. Radiographic principles from the American College of Veterinary Radiology (ACVA) emphasize the importance of patient positioning to achieve clear and accurate diagnostic images. Dr. Thompson performs an ovariohysterectomy on a Labrador retriever named Bella. After the surgery, the technician observes Bella licking her surgical wound despite having an Elizabethan collar. Bella also shows signs of lethargy and a mild fever. What steps should the veterinary technician take, and what are the possible complications to address? Answer. Immediate action. The technician should first ensure that the Elizabethan collar is securely in place and has not become loose or dislodged. If the collar is still in place but Bella continues to lick, the technician should consider replacing the collar with a different type, such as a soft collar, or reassessing its fit. If the wound appears compromised or there are signs of dehiscence, wound opening, the technician should immediately inform the veterinarian and prepare for rebandaging or cleaning of the wound. Monitor vital signs. Bella's lethargy and mild fever are concerning and should be reported to the veterinarian for further evaluation. Post-operative fever may indicate the beginning of an infection or inflammatory response. The technician should monitor Bella's temperature regularly, assess her hydration status, and ensure that she is not showing additional signs of infection such as redness, swelling, or discharge at the surgical site. Pain management. The technician should ensure that Bella is receiving appropriate pain management as prescribed by the veterinarian, including analgesics and anti-inflammatories. Pain can contribute to post-surgical lethargy, and untreated pain can interfere with the healing process. Possible complications. Potential complications include infection as indicated by fever, lethargy, and wound licking, self-trauma to the surgical site if the collar is ineffective, and poor post-operative recovery, which may require adjustments in the care plan. The veterinary technician plays a key role in identifying these issues early and taking action to prevent further complications. What are the clinical advantages of using MRI over CT for evaluating soft tissue injuries in veterinary patients? Answer: MRI magnetic resonance imaging offers several advantages over CT computed tomography when evaluating soft tissue injuries in veterinary patients. Superior soft tissue contrast. MRI provides better contrast resolution for soft tissue such as muscles, ligaments, tendons, and organs like the brain, spinal cord, and liver. This is because MRI uses magnetic fields and radio waves to generate images, which results in more detailed soft tissue differentiation compared to CT, which relies on X-rays, no ionizing radiation. Unlike CT, which uses ionizing radiation, MRI is a non-invasive imaging modality that does not expose patients to potentially harmful radiation. This makes MRI a safer option for cases requiring repeated imaging or in sensitive patients such as young animals or those with compromised health. Ideal for neurological and musculoskeletal conditions. MRI is particularly beneficial for diagnosing neurological conditions, e.g. intervertebral disc disease, brain lesions, and musculoskeletal injuries, e.g. torn ligaments, muscle tears, as it can produce high-resolution images of soft tissues. CT, on the other hand, is more commonly used for bony structures and certain types of tumors, but lacks the ability to differentiate soft tissue structures as effectively. Technician notices a feline patient post-spays exhibiting tachycardia, mydriasis, and reluctance to move. What pain management protocols should be implemented and why? Answer: the feline patient's symptoms including tachycardia, rapid heart rate, mydriasis, dilated pupils, and a reluctance to move are common signs of acute pain. Effective pain management should involve a multimodal approach. Opioid administration. Opioids such as buprenorphine or hydromorphone should be administered for their potent analgesic effects, as they are effective in managing severe pain and are commonly used in post-operative care. NSAIDs, non-steroidal anti-inflammatory drugs. An NSAID such as meloxicam or carprofen can be given to reduce inflammation and provide additional pain relief. However, caution must be exercised to avoid renal toxicity, especially in dehydrated or pre-existing compromised patients. Non-pharmacological methods. Providing a quiet, warm, and comfortable environment can reduce stress and anxiety, which can exacerbate pain and discomfort. Limiting handling and providing soft bedding can aid in the patient's recovery. Explain the importance of adjusting the gain and depth settings on an ultrasound machine during an abdominal scan. Answer: properly adjusting the gain and depth settings on an ultrasound machine is crucial for producing high-quality images. The gain controls the amplification of the returning sound waves, which affects the brightness of the image. Setting the gain too high can result in a noisy image, while setting it too low can make the image too dark to be interpretable. The depth setting controls the range of the scan, allowing the technician to focus on a specific area of interest within the body, such as the liver, spleen, or kidneys. If the depth is too shallow, structures deeper in the body may not be visible, while excessive depth can cause less clarity in the area of interest. In veterinary practice, especially when scanning organs like the liver, kidneys, or bladder, adjusting both gain and depth allows the technician to fine-tune the image for optimal visualization. The American Institute of Ultrasound in Medicine, AM, guidelines stress that improper settings can lead to inaccurate diagnosis, especially when visualizing deep abdominal structures in larger animals. What should the veterinary technician consider when preparing to administer a chemotherapy drug to a feline patient? Answer: when administering chemotherapy drugs to a feline patient, the technician must take several precautions. Proper dosage calculation. Chemotherapy drugs are often dosed based on body surface area, BSA, rather than weight, especially in cats. The technician should verify the drug dosage calculation and ensure the correct amount is prepared Personal protective equipment (PPE). Chemotherapy agents are hazardous, so the technician must wear appropriate PPE, including gloves, gowns, and eye protection, to avoid exposure to toxic substances. Safe handling. The technician should ensure the drug is prepared in a well-ventilated area and that any spillage is promptly cleaned according to protocols for hazardous drugs. Monitoring for side effects. The technician should closely monitor the patient for signs of chemotherapy side effects, including gastrointestinal upset, changes in behavior, or signs of infection, and report these to the veterinarian. According to the American Veterinary Medical Association (AVMA), strict protocols must be followed when dealing with chemotherapy drugs to ensure efficacy and minimize risk. What are the key indicators a veterinary technician should monitor during the recovery phase from anesthesia? Answer: during the recovery phase from anesthesia, the veterinary technician should monitor temperature. Hypothermia is a common complication during anesthesia, so it is crucial to monitor the patient's body temperature and provide warmth if necessary. Respiratory rate. The technician should ensure the patient's breathing is steady and normal. Hypoventilation or apnea should be addressed by providing supplemental oxygen or adjusting the airway. Circulation. Monitoring heart rate, blood pressure, and pulse quality is vital to ensure adequate perfusion to organs and tissues. Any signs of cardiovascular instability must be addressed promptly. Pain assessment. The technician should assess the patient's pain level using appropriate scoring systems. Signs of pain should be managed with analgesics as prescribed. Post-operative monitoring. The technician should continue to monitor the patient's consciousness, mobility, and general response to ensure they are recovering well from anesthesia. What should a veterinary technician look for in a CBC complete blood count to assess a patient's hydration status? Answer: in assessing hydration status through a CBC, the technician should focus on hematocrit (PCV). A high hematocrit value may indicate dehydration as it reflects the concentration of red blood cells in plasma. Dehydration leads to a higher proportion of red blood cells relative to plasma volume. Plasma protein concentration. A high level of total plasma protein, especially albumin, may also indicate dehydration, as dehydration leads to increased protein concentration due to decreased plasma volume. White blood cell count. While this can indicate infection or inflammation, a high white blood cell count might be seen in cases where dehydration is secondary to illness. Electrolytes, if available, though not part of the CBC, electrolyte imbalances like high sodium can also indicate dehydration, and many laboratories provide this information in the same panel. Explanation: hydration status can be inferred from changes in hematocrit and plasma protein levels. The veterinarian may order further diagnostic tests to confirm the cause and degree of dehydration, allowing appropriate treatment interventions to be started promptly. A client is struggling with the decision to euthanize their terminally ill pet. How should the veterinary technician communicate and support the client through this process? Answer: the technician should approach the conversation with empathy and sensitivity, recognizing the emotional weight of the decision. Key steps include active listening. Allowing the client to express their feelings and concerns without interruption can provide emotional relief and help the technician better understand the client's perspective. Providing information. The technician should offer clear, factual information about the pet's condition, explaining the expected prognosis, pain management options, and the benefits of euthanasia in preventing further suffering. Supportive tone. The technician should reassure the client that they are not alone in this decision and that it is okay to seek guidance. Offering comfort and understanding can help clients feel supported during this difficult time. Respecting client's decision. Ultimately, it is important to respect the client's final decision, whether they choose euthanasia or another course of action, and continue to provide care and emotional support. The American Veterinary Medical Association (AVMA) emphasizes the importance of compassionate client communication during the euthanasia decision-making process. Explain how the life cycle of Toxocara canis contributes to its pathogenicity and zoonotic potential. Answer: life cycle features: ingestion of eggs. Eggs hatch in the host, releasing larvae that migrate through tissues. Transplacental transmission. Puppies can acquire infection in utero. Environmental persistence. Eggs remain infectious for years. Pathogenicity. Larval migration causes tissue damage. E.g., liver, lungs. Heavy infections in puppies lead to intestinal obstruction and malnutrition. Zoonotic potential causes visceral larva migrans or ocular larva migrans in humans. Regular deworming and hygiene practices are critical to managing risks. What are the key differences between Giardia and Coccidia in terms of their life cycle diagnosis and treatment? Answer: Giardia and Coccidia are both protozoal parasites that affect the gastrointestinal system of animals, but they differ significantly in their life cycle. Clinical signs, diagnosis, and treatment. Life cycle, Giardia. He has a direct life cycle with animals becoming infected by ingesting cysts from contaminated water or feces. Once ingested, the cysts transform into trophozoites that colonize the small intestine. Coccidia, such as Isospora or Armyria, also have a direct life cycle but involve oocyst formation which sporulate in the environment. The oocysts are ingested, and upon reaching the intestine, they release sporozoites that infect the intestinal lining. Diagnosis, Giardia. Diagnosis is typically done by examining fecal samples under a microscope, direct flotation, or using ELISA or IFA tests for antigen detection. Coccidia. Diagnosis is done through fecal flotation, where oocysts are detected. In some cases, PCR tests may be used for more accurate detection. Treatment, Giardia. The main treatment is metronidazole or fenbendazole, which target the trophozoite stage. Coccidia. Treatment typically involves sulfadimethoxine albin or ponazuril, which target the protozoal cells in the intestines. Both conditions require strict environmental cleaning to prevent reinfection, as oocysts can survive in the environment for extended periods. Dr. Green is treating a 3-year-old beagle, Daisy, who is presenting with bad breath, swollen gums, and a reluctance to eat. Upon examination, Dr. Green discovers that Daisy has a significant amount of plaque buildup on her teeth and a large abscess at the root of her molar. Daisy's owner is concerned about anesthesia and the cost of dental surgery. How should Dr. Green proceed in treating Daisy's dental issues, and how can he address the owner's concerns? Answer. Step 1. Diagnosis, oral examination. Dr. Green has already identified signs of periodontal disease, plaque, swollen gums, abscess. He should conduct a thorough oral examination to assess the extent of the damage to Daisy's teeth and soft tissues. Radiograph. Dr. Green should take dental radiographs to assess the root structure, bone loss, and the abscess's severity, as this will guide treatment decisions. Step 2. Treatment plan, dental cleaning and scaling. Scaling and polishing should be done under general anesthesia to ensure proper cleaning and to access subgingival areas. This will remove the plaque and tartar that are contributing to the periodontal disease. Extraction of damaged teeth. Given the presence of an abscess, Daisy likely requires an extraction of the affected molar to prevent further infection. This procedure will require anesthesia, and Dr. Green should explain the necessity of the extraction for Daisy's long-term health. Step 3. Addressing owner's concerns, anesthesia safety. Dr. Green should reassure the owner by explaining the safety protocols in place, such as pre-anesthetic blood work to assess organ function and the use of modern anesthetic agents with minimal side effects. Cost. Dr. Green should outline the cost breakdown, emphasizing that the surgery, while costly, will prevent the worsening of Daisy's condition and help avoid more expensive treatments in the future, such as the need for more advanced procedures or hospitalization for complications from untreated abscesses. He could also offer payment plans if the clinic provides them. Post-operative care. Dr. Green should educate the owner on at-home care post-surgery, such as feeding soft food, administering prescribed antibiotics, and monitoring for any signs of complications. Ethical consideration. Dr. Green must obtain informed consent before performing any procedures, explaining the risks and benefits of anesthesia and surgery, and ensure that the owner feels comfortable with the treatment plan. What are the primary differences between ectoparasitic and endoparasitic diseases, and how do the treatment protocols differ for these two categories of parasitic infections in veterinary medicine? Answer. Ectoparasitic and endoparasitic diseases differ in terms of the organisms involved, the affected body systems, diagnostic methods, and treatment strategies. Ectoparasites. These are external parasites that live on the surface of the host, such as fleas, ticks, mites, and lice. Common clinical signs include itching, hair loss, skin irritation, and inflammation. Treatment. Treatment often includes topical or systemic parasiticides, e.g. fipronil, selamectin, environmental control measures, e.g. insecticidal sprays, and regular cleaning of the animal's bedding and living areas to eliminate immature stages. Diagnosis. Diagnosis typically involves visual inspection, skin scrapings, or flea combing. Endoparasites. These are internal parasites including intestinal worms, roundworms, hookworms, tapeworms, protozoa, and lungworms. Clinical signs can include vomiting, diarrhea, weight loss, anemia, and coughing. Treatment. Treatment involves anthelmintics, e.g. fenbendazole, pyrantel pamode, and in some cases antifungal or antiprotozoal medications, e.g. metronidazole, ponazuril. Diagnosis. Fecal flotation is typically used to diagnose intestinal parasites by detecting eggs or larvae in the feces, while blood tests or PCR may be used for some systemic parasitic infections. In both cases, a combination of medication and environmental management is essential to effectively control and prevent reinfection. Discuss the process of dental charting in veterinary practice. Why is it important, and what are the critical elements that must be included on a dental chart for accurate diagnosis and treatment? Answer: dental charting is a vital part of veterinary dental care, providing a systematic record of the patient's oral health and ensuring continuity in care across different appointments. The process involves recording the condition of each tooth and the surrounding structures, providing a baseline for comparison in future visits. Critical elements to include on a dental chart: tooth numbering. Use the standardized system like the Trident system to assign each tooth a number, which simplifies identification. Tooth condition. Document the condition of each tooth, noting any abnormalities such as fractures, malocclusions, and decay. Gingival health. Record the health of the gums, including signs of gingivitis, recession, or pockets deeper than 4 millimeters, which indicate periodontal disease. Plaque and tartar. Note the amount and location of plaque and tartar buildup, pathologies. Record findings of abscesses, tumors, cysts, or resorptive lesions. Radiographs. Include radiographic findings to document any underlying bone loss, root abscesses, or fractures that are not visible in the oral examination. Importance of dental charting. Provides a comprehensive record of a pet's dental health that can be referred to over time. Helps in planning treatments and tracking disease progression or regression. Aids in communication with owners about the pet's oral health and justifies the need for treatment legally. Protects the veterinary team by documenting the condition of the pet before, during, and after any procedures.